Hi, everyone. Thanks for that introduction, Laura. I'm Claire McSweeny. I'm a medical student at UCD, and today I'm going to talk to you about our research project looking at the development of a survey to examine the prevalence, characteristics, and experience of Charles Bonnet syndrome in the Irish visually impaired population from a patient perspective. I just want to say I have some slides, but I'm going to be explaining everything, so you don't need to have them in front of you. So the three project aims were to conduct a systematic review of the literature surrounding Charles Bonnet syndrome and to identify the prevalence, clinical presentation, and patient experience of Charles Bonnet syndrome in an Irish visually impaired population. And then we wanted to use this information to develop an accessible online survey that could be used to capture Charles Bonnet syndrome in Ireland. Next slide. Perfect. The first step was to gain an understanding of what is currently known about Charles Bonnet syndrome in the scientific community. So we did a review of existing literature, and it guided us in identifying the main themes surrounding Charles Bonnet syndrome. So we found that Charles Bonnet syndrome is common. Reported prevalence has been anywhere from 0.4 to 40%, and it occurs across many causes of vision loss. And there's also variation in the content of hallucinations as well as the patient impact. Next. We then used these major themes to develop our online patient survey. So we consulted with our community partners at Fighting Blindness, as well as ophthalmologists across Ireland and in Northern Ireland, and most importantly, individuals living with visual impairment, because we wanted to ensure that the survey reflected the concerns and questions of healthcare providers, as well as individuals living with sight loss. So we held focus groups with individuals with sight loss, as well as our community partners, so we could gain feedback on the survey questions to ensure that the language used was appropriate and that it was accessible. And we decided to use the online SurveyMonkey platform because it is compatible with screen readers. Next. So we have sent out a first pass of the survey. This has been a soft launch, and it's been sent out to the Fighting Blindness patient base via email. And we've also provided an option to complete the survey over the phone if individuals are not familiar with the SurveyMonkey platform. Next. So I want to preface this by saying that our results are very preliminary. We only have 28 survey responses thus far, but it has given us some insight into how prevalent Charles Bonnet syndrome is in Ireland. So to capture prevalence, the question we asked was, have you ever experienced seeing things that were not actually there? And 41% of people who filled out the survey said that yes, they had. So this is slightly higher than reported prevalences, indicating that perhaps Charles Bonnet syndrome is more common than previously thought. Next. So from the survey, we got an idea of the types of hallucinations experienced by individuals. So people reported as seeing people and faces, objects, geometric shapes, trees, and flowers. And sometimes these visions were clear and in color, but also sometimes they were black and white or blurry. Next. Individuals also reported that they experienced visual hallucinations across a range of frequencies and duration. So some people saw their hallucinations continuously, some daily, and some monthly, and the duration of the hallucinations varied. So some people reported that their visions lasted seconds, minutes, or in some cases were continuously present. Next. The patient impact was also variable. So patients reported emotions skewed towards more negative experiences. So although a few people felt amused, most individuals reported as feeling annoyed, irritated, startled, anxious, frightened, and in some cases terrified by their visual hallucinations. And in addition, the visual hallucinations disrupted many daily activities, including cooking, watching TV, exercising, walking, sleeping, reading, and relaxing. Next. Although, as I said, these are very preliminary results, our survey responses did suggest that Charles Bonnet syndrome is not usually discussed during clinical ophthalmology appointments in Ireland. So of the individuals who mentioned their visual hallucinations with their GP or their ophthalmologist, only 2 of these healthcare providers had some awareness of Charles Bonnet syndrome. So this, coupled to the fact that many individuals reported as feeling relieved after hearing about Charles Bonnet from our survey, shows that there's a real need to increase awareness of Charles Bonnet syndrome among individuals living with visual impairment in Ireland. So in conclusion, I would just like to first thank everyone who has had a hand in helping us with the development of this survey. It truly was a collaborative effort, and all the individuals who provided input, feedback, and guidance on this project were instrumental. I want to finish off by saying that the main reason we're trying to learn more about Charles-Bonnet syndrome in Ireland is to increase awareness among individuals with visual impairment as well as their healthcare providers. And we want to encourage the continuous collaboration with other Charles-Bonnet syndrome support groups such as Esme's Umbrella, so that we can continue to provide individuals with visual impairment information about Charles-Bonnet syndrome and strategies which can be used to help them cope. I want to thank you all for listening to me today. Right now, I have the QR code for the survey up on the screen. So if you want to access the survey, I encourage you to fill it out. You can also access the survey at fightingblindness.ie. Thank you so much.